Yeah, thanks. Thanks, Dr. Uli. I'm going to share my screen. Yeah, can you guys hear me and see my screen?
Yes. All good.
Yeah. Yeah, first of all, I'm not a doctor, I'm a technologist, and I am really awed and humbled to be in the presence of all of you and the amazing work you've all done. I am here because this is a personal mission. I was diagnosed with coronary artery disease last year, and I was suffering from shortness of breath and fatigue. And I could not actually schedule an ultrasound or a 2D ultrasound in time. But our product was ready. I was able to use it, understand my own heart failure risk. And I also had something very up close and personal happen in the family. A 40-year-old relative complained of fatigue, and we said, hey, it has to do with your habits, your food, etc. We made him get on a 3-month tennis program, and 3 months later he found that he was worse off. And it took us a year after that, with the help of doctors, to conclude that he was suffering from heart failure. It's a silent killer. It creeps up, as you all know, before you even realize. About 80% of heart failure cases are detected in the emergency room, which for a chronic condition is really not acceptable. I'm a technologist. I was an early engineer at Yahoo and then at Amazon, and I've been working in AI since the late 90s. So I have a healthy respect and a healthy skepticism for what it can do and cannot do. And I'm also here to introduce my co-founder, Dr. Abhijit Ray. Abhijit is a fellow from both Harvard and Johns Hopkins. Got his MD and DM from Edinburgh, is FRCP, and is a physicist and a cardiologist. So has a physics and a cardiology background, and that allowed him to actually find the signals for heart failure in the ECG itself. So as many of you know, that today the standard to detect heart failure is the ultrasound or the echocardiography, and which takes a lot of, it requires a radiologist, requires people to go there, and it's often detected after the fact. So with Abhijit's work, over 7.5 years of clinical research, we're able to actually predict heart failure before it happens. And it's we believe it's groundbreaking. Today, the US spends about $170 billion in treating heart failure. Every taxpayer is spending about $244 a year just to cover that cost. And we are able to predict it, within 90 days before it happens. And that gives a chance for the medical system to intervene and to actually prevent it from progressing to heart failure itself. And we do this with a standard EKG machine. Just going over the status of heart failure, most people are detected with heart failure once they reach symptomatic heart failure. And when they have fatigue or shortness of breath, or, pedal edema, palpitations, etc. And by that time, there is no cure for heart failure. I think we all know that. Our goal was, can we actually catch it before they reach stage C? And with Dr. Abhijit's work, we're actually able to predict that the person is in stage B, and we're able to actually predict that stage C is within about 90 days away. Today in the US, one person every 33 seconds is one death every 33 seconds. Almost a quarter of adults, US adults, will experience heart failure once in their lives. And the millions that go undiagnosed, that are asymptomatic, are the people that we want to address. There's 50% mortality in 5 years, 43% get rehospitalized 4 times a year. This both places a huge burden on the health system, but additionally, the hospital rehospitalization impacts even the credibility of the hospital itself. So if we can get to this before it happens, then it's going to make a very big difference across the board. There's today no way to predict heart failure, and by the time it's detected, it's already too late. Our breakthrough is that we've used AI and the work that Dr. Abhijit has done to predict it before it becomes irreversible. There's also a massive social impact because the rest of the world is about 9 years younger in heart failure than the US itself. So this has a potential global impact. We believe that every adult above the age of 40 should actually have a chance to take a test like ours and detect if they have heart failure or not. The work has come with about Abhijit has worked for about 8 years with Dr. John Hampton, who's written the textbook that almost every person that's studied electrocardiography knows. He's also had 7.5 years on left ventricular ejection as well as heart failure itself. We've done clinical trials with over 130 patients across 3 different hospitals, and we have over a 95% accuracy. Post that, we carried out post-trial verification of almost 658 tests, 2 places in the US and 2 places in India. And subsequently, he has verified this against the Framingham Heart cohort with about 21,800 cases. He has a PPV on that data, which is being published in the New England Journal of Medicine, coming out shortly. The solution is really simple. We've actually built the tech. It's integrated. It's ready to go. We have been testing it. Our go-to-market is about 2 to 3 months out, but there are already uh, customers who are using it. The heart signals are taken with the ECG device either at at the hospital or at home. The signals get uploaded into a HAIF application. The server runs on the cloud, and the results are available within 2 to 3 minutes to the which the result is currently a traffic light result. It says, does a person have no immediate risk of heart failure? Do they have a risk within the next 90 days? And we're actually able to detect that heart failure is present, but we may actually message that differently in our go-to-market. The advantage of our system is that it can be operated by any trained professional. The setup is really quick, so it can be tested anytime, anywhere. Um, Very cost effective. We are launching in the US at about $7 a test, and in the Indian market at about 150 rupees a test. The speed of diagnosis is just a few minutes. We've essentially taken all of the work, all of the technology, all of the complexity, and packaged it into something that's really easy to use. We also don't need any PII in order to run our test and to predict the answer. There is a little bit of competition, but they're all looking at slightly different problems. Some of them are just detecting low ejection fraction. There are SAMD solutions for depression or for arrhythmia, but really nothing right now is able to predict heart failure in advance. I just want to also take a moment to quote Dr. Uli himself. When most patients are really surprised when heart failure is detected, it progresses very slowly. And by the time they're detected, like we said, most of them in the ER, it's really amazing that we're not able to stop it before it reaches that point. We have radiologists who've really seen this, used it, and feel it's a revolutionary solution. And Dr. Nak Pandian says that all roads in cardiac lead to heart failure. We've had direct interest from the US government. We actually had a chance to meet with them, and they've been working with us for the last 3 or 4 months to understand how to bring this at a larger scale. We don't know exactly how and when the outcome is, but we know that there is interest from multiple governments to bring this solution at scale. We've also been accepted to the NVIDIA Inception program for startups, which is actually a fairly difficult program to get into. The TAM for us is about 39 billion, and it's growing at 18.7% year over year. Now, the question is who's going to pay for this solution? Given the price point that we're entering at, we feel that um, the individuals will pay in the short term, but we are working with the insurance to actually get it into the coding system as well. So in the long term, it will be part of the system. But in the short term, we feel that it's really cost effective, that when people know the impact of this, that individuals can afford to pick up the cost. We are looking at a B2B business model. We will work with healthcare institutions and device manufacturers, and we've already started that process. We have a few doctors and hospitals that have signed up, and one of the big things is that in the go-to-market, we have PCP networks, we have HMOs, and in terms of the company traction, we raised after the 7.5 years of research, we
All
raised
right,
an
last
angel
slide.
round. Okay, we raised an angel round, and we were oversubscribed. The angel round was raised just 6 months ago. We also have a Grammy Award winner who was impacted with heart failure, who joined us as a brand ambassador. We've completed our verification, and finally, we just signed an agreement with a wellness company that will allow us to sell on 1 million devices, our solution on 1 million devices. We're very confident on the financial side. Our product is done. We're ready to
All right,
launch.
thanks,
Uh,
Bharat.
Thank you.
Let's move
Yeah.
on. All right. Let's bring our judges back on the panel. Gary, go ahead.
Hi, thanks, Uli. Very interesting presentation. I know the space pretty well from some investments that we've made on both sides of the fence, on the PPG EKG side of it, as well as on the risk assessment for coronary artery disease and failure. So I guess, walking away from the presentation, the one thing that I'm confused about is exactly how you're promoting this. I mean,
Yeah.
clearly it's not going to replace echocardiogram and CT angio and all of that for patients who have already existing congestive heart failure and are being treated. So what I'm hearing is that this is more of an early preventative screening device, which is a huge market because there's really nothing that's straightforward and simple. That's one first part of my question. So are you looking at this more on the screening side? I can see the potential value down the line, but you'd really have to prove that.
Yeah.
And then the second part of the question is that if that's the case, where do you see this being deployed, and what's the level of EKG that you need? Because as you know, there's a difference between a 12-lead EKG from a standard machine versus a watch that's giving you, 2 leads or 3 leads. David Albert will tell you all that himself. So that's where I'm unclear.
Yeah, Gary, that's a fabulous question. Both of them, and I'll start and then let Dr. Abhijit take over from there. So we definitely see we see this as being available to every adult above the age of 40 and then some more, because there are so many cases of sportsmen just falling on the court and things like that, and those conditions can also potentially be caught. At least a certain percentage of those conditions would be tied to heart failure that can also be detected. So we feel every adult over the age of 40 should have access to this test, and at least 4 times a year. And that's, I think, part of the target. The second really big market that we've tapped into is the wellness side. So we just signed an agreement with a wellness company to sell our product on 1 million devices. So as they're doing their fitness and wellness, they just get continuous monitoring for heart failure. And on the quality of the ECG, we've we've built it on the 12 lead, but we just recently tested with great accuracy on a one lead system. But I'll let Dr. Abhijit comment on that.
Yeah, so to answer your question, basically this is not a diagnostic device or diagnostic software, it's a screening software. So what we're aiming to do is basically give the signal to the patient that yeah, you might be having heart failure in the next 2 to 3 months, so you must consult a cardiologist. It's more important for other departments than the cardiologist office itself, because the cardiologist will have access to all the every test which to diagnose heart failure. That's fine, but it is more important for, say, an anesthesiologist or a general surgeon or any other place where the EKG is being done on a regular basis, say a preoperative checkup or a health insurance or things like that, and just streamline patients into that. And yeah, we are getting excellent results of the handheld ECG machines, like the 2 lead and 6 lead, which is really good, because for patients we can't actually ask them to do a 12 lead EKG at home. That it might be a bit difficult, but yeah, if since the handheld ECG is giving good results, we are very optimistic about it.
Great. Jay?
Yeah, I had a very similar question to that. So I'll shift over to, I also like it if you think about it in the context of patients who are part of any kind of a value-based care program, because now you have a real easy, obvious payer who's going to want to catch this 30 minutes earlier or 90 days earlier. So I'll just make that comment.
Yeah.
The other thing, I would love you guys to change the last slide and add a 0 before the X, because I loved everything about the presentation except for the last 10 seconds where in the upper right-hand corner it said 3X. If you do what you're saying, I don't see why this wouldn't be a 30X return to investors. It's magnificent in the United States in terms of its upside. You think about it around the world. I mean, I would love to interrogate more offline why it's only a 3X. And if it is a 3X, you'll never raise venture capital. So there's that as well.
Yeah.
Jay, that's a great point. Let me take that. We're technologists. We try to be we try to be a little conservative in what we say, but we believe this is a massive market. Every adult over the age of 40. So even 30X, could be tested.
Right.
We think it's big.
Yep.
Good point. All right. Thank you very much.